we'll do the same for
Excuse me. Sorry.
great. No, you're okay. No worries. Um, and just to say out loud, I know that we are recording. We would love to have you on camera, but if you don't feel comfortable being on camera because we are recording, please feel free to just let one of us know in the chat or, privately that you don't feel comfortable and you can definitely go off camera. But just to get us started, again, welcome to the Strive onboarding meeting today. We are super excited to have you. Congratulations and welcome to the Office of Sexual Health and Youth Development at the Department of Public Health. You are here, and we are super excited to be partnering with you and your organizations and your staff to be able to deliver this evidence-based intervention for Strive. Next slide, please. So, really quick, here is the agenda for today. We will do welcome and introductions. I will have my staff welcome themselves, and then we will do introductions. Tanisha will lead that, and also an icebreaker in the chat. We will go over the Office of Sexual Health and Youth Development and who we are as an office and the different programs that make our office. We will also give you all an overview of Strive and what the program will be delivering this fiscal year and what the requirements are. And then also we will go over just a small overview of programmatic data collection requirements. You will get the full um, data and evaluation training tomorrow, but we want to incorporate just an onboarding smidget of what it is required for this grant. And then we'll have an opportunity to ask questions. So if you have any questions, you're more than welcome to either put them in the chat or just wait till the Q&A portion of the presentation. Next slide. Tanisha.
Yes. So hello everyone. So before as we get started and for a quick icebreaker question, I want everyone to answer in the chat which two companies you would like to be sponsored by. So this would be like a sponsorship deal. It could be anywhere from Love Pop in the cards to like any other company that you know, even if it's a startup. So just like start answering in the chat as we continue to move forward with the introductions. So perfect. So I'll just lead by example. I think the company I would like to be sponsored by would definitely be an airline. I definitely think I would want like free flights to anywhere for a little bit just to keep that going. Okay, I'm seeing things coming in. Target's definitely a great one. Yep. So yeah, keep those rolling in as we continue to the introduction portion of the Office of Sexual Health and Youth Development. So first, I'd like to introduce Jill Clark, who isn't here at this time. She's our division director, and she wishes us well, and she's really excited for the Strive program as well. But moving on, I'd like to pass on. I'll introduce myself. I've met a lot of you before during the meet and greet meetings we've been having this last week and the week before. So I'm really happy to be here officially onboarding you all, and I'm going to be the Strive program coordinator for this fiscal year. And then I'll pass it on to Lizette to introduce herself.
Awesome. Tanisha, can you tell folks what your pronouns are?
Yes, my
Awesome.
pronouns, I use the she series for my pronouns as well.
Awesome. Hi, everybody. I'm Lisette Gil Sanchez. I also use the She Series, and I'm the director of the Office of Sexual Health and Youth Development. And I'll pass it to Ria.
Good morning, everyone. My name is Ria, and I'm the epidemiologist that supports Strive for the Office of Sexual Health and Youth Development, and my pronouns are she, her.
Moving forward to the second page of introductions, I want to pass the I want to introduce Sin today. So Sin Wong, you can introduce yourself, let everyone know your role and your pronouns.
Everybody, how's it going? Good morning. My name is Sin Wong. I use they, them, and I'm the Youth Engagement Coordinator supporting OSHID. Nice to meet you. I would also like to introduce Martha. Martha is not here with us this morning, but Martha Guerrero, she uses she, her pronouns, and she is our program coordinator supporting the adolescent sexuality education program in our office. Pass it over to Michaela.
Hi, everyone. My name is Michaela McDonald. I use the she series pronouns, and I am the program coordinator of logistics and support for the Office of Sexual Health and Youth Development, and I will pass it to Brenna.
Good morning, everyone. Brenda McLaughlin. I use the she, her pronouns, and I'm an epidemiologist who supports the Office of Sexual Health and Youth Development. And I'll pass it over to Marcos.
And I don't know that Marcos is here yet, but Marcos Palmarin is our capacity building coordinator, and he uses the He series, and he's also in the Office of Sexual Health and Youth Development. Next slide, please. Awesome. So our office is centered in these values and is centered on racial justice, data-driven sustainability, trauma-informed care, positive youth development, reproductive justice, and health equity. We do everything that we do, and all of the programs that we offer the Commonwealth of Massachusetts, we are centered around these values. Next slide, so that we can get the definitions of these values and dive a little bit deeper into what they actually really mean. So racial justice is the proactive reinforcement of systems, institutions, policies, and practices, attitudes, and actions that produce equitable power, access, opportunities, treatment, and impacts and outcomes for all. When we talk about reproductive justice, is the human right to maintain personal bodily autonomy, to have children, not to have children, and parent the children we have in a safe and sustainable communities. When we talk about health equities, we mean that everyone has a fair and just opportunity to be healthier. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs, fair pay, quality education and housing, safe environments, and also healthcare. When we talk about data-driven programming, we really look at curricula and program practices that are evidence-based and are delivered in a manner that is consistently leads to improvement in outcomes for the young people we do serve. Next slide. When we talk about sustainability, and it includes different strategies from building internal capacity to securing new funding, to incorporation of program practices or policies to other organizations, and to ensure continuity. Trauma-informed care or healing-centered engagement, which we're adopting that language as well, and those practices as an organizational structure and treatment framework that involves understanding, recognizing, and responding to the effects of all types of trauma. When we talk about positive youth development, it engages youth so that youth are empowered to reach their full potential. Positive youth development approaches build skills, assets, and competencies to foster healthy relationships and strengthen the environment and transform systems. Next slide. With all that, our Office of Sexual Health and Youth Development is comprised of several different programs that work together to increase access to comprehensive sexuality education, to decrease teen and unintended pregnancies, decrease the incidence of sexual transmitted infections, increase sustainability of delivery of networks working with youth and other priority populations, increase protective factors for young people using positive youth development lens. Next slide. And these are all of our programs. You all have been successfully funded to administer or to deliver successful teens, relationships, identities, and values education, or STRIVE. We also have the Adolescent Sexuality Education, which is a state-funded program that supports sexuality education across the state. We also have a federal sexuality education program, Personal Responsibility Education, or PrEP, and that's federally funded. And last but not least, we have a secondary prevention program, which is the Massachusetts Pregnant and Parenting Teen Initiatives for parents under 25. Next slide. We do all of this with the aims to really hone in on our values and what we really want to accomplish or allow young people to accomplish while they're in our programs. And we do this by improving sexual health outcomes, by prioritizing positive youth development, improving access and supports, by increasing protective factors and keeping youth at the forefront by including youth voices in budgetary and programming decisions by developing a youth advisory board. We're hoping to do this way before in the next 5 years. So these are our aims and our goals for the upcoming years. The other aim is to really operationalize our values, build capacity of youth and youth serving staff at an individual, organizational, and institutional level to address the root causes and social determinants of health that contribute to health inequities experienced by populations they serve. Next slide. And I will pass it to Tanisha to provide you with a Strive overview.
Yes. So once again, congratulations everybody for getting your Strive contract. We did briefly go over this in the meet and greet, but it's never too much to go over the Strive goals. So once again, the initiative is meant to increase life opportunities for youth, and it tries to do this by delaying the onset of sexual initiation, to prevent adolescent pregnancy and STIs and HIV infections rates. It also works to increase youth connections to caring and trusted adults in their community, as well as increase internal and external developmental assets through promoting positive youth development and programming. So as you guys know, Strive does come from the SRAE funds, and that is abstinence-only education. So Strive is really meant to focus on the positive youth development aspects of it to further bolster these goals and to kind of like talk about sex in a way, well, to not talk about sex, to move forward with this program and delaying sexual initiation by promoting aspects of their life and health that really do promote that further promote the goals that Strive have set and the goals that you guys have been doing already as organizations. So with Strive, the priority populations fall in these categories. You have to be serving youth between the ages of 10 to 15 for this programming, who identify as Black, Hispanic, Latinx, male, or LGBT. We also have a new focus with youth with different capacities of mental health. Oh, sorry, not mental health. I apologize. Youth with different types of intellectual and developmental disabilities, as well as serve a minimum of 65 youth per fiscal year. So this doesn't mean 65 youth per cohort. It just means by the end of the year, 65 youth have to be served, just to make sure to clarify that for anyone. In addition, like as the HOPE providers who have who have been chosen, I wanted to highlight the communities you guys serve, as well as the programming you are hoping to use this year. If there are, we have talked about these and they have been set in stone, but if anyone in this group has decided that they would like to move with top programming, please let us know so we can help you with that as well. But just generally, I want everyone to welcome the Boys and Girls Club of Boston/Chelsea, the Brockton Neighborhood Health Center, the Indenburg Center, Lowell Community Health Center, Girls Inc. of the Valley, and Girls Inc. of Blinn for our fiscal year 2025. I look forward to really working with you guys, and especially the different communities you guys serve, especially as I'm unfamiliar with these areas. So throughout this programming for Strive, there are some data we want to look at that kind of informed our need for it and the importance of these programming, despite the fact there are positive markers in this area in Massachusetts. So I'd like to pass on the mic to Ria as she's able to further talk to you about these data sets.
Hi, everyone. Sorry. Thank you so much for joining today. It is a pleasure to meet all of you again. So, Office of Sexual Health and Youth Development's programming strategies are grounded in evidence-based practices, and for the Strive initiative, several indicators were taken into consideration to determine our target and our priority populations. So here are a few points that were taken into account. From 1970 to 2021, as you can see in the graph, there was a decrease in the number of births in Massachusetts for individuals less than 30 years of age. Next slide, please. And while Massachusetts had one of the lowest teen birth rates in the country in 2021, the state has some of the highest inequities in the teen birth rate based on geography and race or ethnicity. If you can look at the bar graph, you can see that the Hispanic teen birth rate in Massachusetts, which was 21.1, was 10 times higher than the birth rate for individuals who identified as non-Hispanic or white. And additionally, youth of color, youth with IDD and LGBTQ plus youth, they may experience both systemic racism and structural discrimination and barriers associated with sexual orientation and or disability status. Next slide. So Massachusetts state identified 25 municipalities with the highest teen birth rates in 2021, and with the support of all of you, Strive will be serving at least 10 of these towns or municipalities that had the highest birth rates in Massachusetts. Next slide. So these are the performance and process measures that the Office of Sexual Health and Youth Development utilizes to track the implementation and delivery of the program as well as the impact of the program. The process measures, we have three of them. One for the first, which Tanisha described, is that each site has to serve at least 65 youth annually. Second, 75% of the youth served complete at least 75% of the curricular hours. And third, 75% of the youth served are within the STRIVE priority populations. The performance measures which analyze the impact of the program, the first one is 85% of the youth who report having no positive connections to adults on the pre-survey report having positive connections to adults on the post-survey at program completion. 60% of the youth report feeling connected to school and community at program completion, and 10% of the youth report an increase in life skills that includes communication, emotional management from pre to post survey. And I will be discussing all of these tomorrow in the data and evaluation section as well. Next slide, please.
So as part of the programmatic expectations for this, for working together, we have to follow the contract conditions, fulfill data reporting, and do monthly billing on EIM as well. So what this really looks like on a month-to-month basis is like mostly monthly or bi-monthly contract management or grant management. So in this, we'll set up meetings. You'll be setting up meetings with me and Lizette and maybe sometimes Ria, where we will discuss like how things have been going monthly, if there's anything that we need to be aware of, as well as provide office updates as needed and discuss technical assistance as needed as well. During these visits, we also get the chance to just discuss different things to ensure compliance for the contract, as well as discuss what's needed to do for site visits. As you guys may know, DPH is going to have a federal site visit as well, and some of you guys have been picked to be part of that. So just like this, these are the sort of things that get folded into our meetings. And of course, as we schedule and as we go through the month to month, we'll be able to discuss program successes and challenge to best work together so I can support you to make sure we reach the contract compliance that's needed. As part of that contract compliance, we will talk a little bit about data collection tools today. This is just really to introduce what we're going to be expecting, and then tomorrow you'll be led through a more technical PowerPoint to just kind of like walk you through how to actually do these, actually use these tools. Like for example, process and attendance logs are expected for all the curricula that you're going to be implementing. So for Project AIM, the Real Essentials, Circles, and Voices, they're meant to be input in real time or within 2 weeks of completing your cohort in REDCap. Additionally, if you're finding yourself using the Wyman database for TOP, we will work with you individually to walk you through that process, because Wyman does have their own separate system. So you'd have to work on the Wyman database system and the stuff you have to do for Strive as well. So since that's a bit more involved as a process, we could definitely walk you through that in a whole separate meeting, because REDCap will take its own time as well. Additionally, youth surveys, like mentioned by Ria, the pre and post surveys are supposed to be completed before and after the program, your cohort completion. So of course, this is both done on REDCap, but the option of paper surveys are available if your organization has special circumstances for it. And if that is the case, please just let us know in advance so we can work with you to get to coordinate any paper surveys if needed, because they do need to be sent into our office, and we want to just track delivery and make sure it's easy on both of our teams. And lastly, online service delivery reports are also need to be submitted. This is also currently collected on REDCap, so to make it a little easier on you guys than before. So it mostly captures youth not served by curriculum-based programming, and kind of talks about like what was going on in the month, and really goes and is usually tied to like the EIM billing as well. So those two do need to be put in together on a monthly basis. Just like the billing is all due on the 15th of the month, and of course, if anything happens between the 15th and our last meeting, we are able to cover our bases through the monthly meetings that we have. So if anything does come up, we can always do that as well. So I know we've been talking for a while, so I do want to ask if anyone has any pressing questions in this very moment before we continue.
Lena?
Thank you. I wanted to ask about the captures under service delivery reports. That second bullet captures youth not served by the curriculum-based program. I'm not really sure what you mean by that.
So hi Lena, this is Sin.
Go ahead, Sin.
So what we asked for in the service delivery report is also any youth development activities that you were doing outside of the curriculum, outside of programming. So that could look like a one-time workshop, that could look like some sort of event that you're holding. So these are not youth that you regularly serve in programming, but youth that you may be seeing in a one-off capacity. Does that sort of answer your question?
It does,
Yeah.
but I just want to clarify. So is that in addition to the youth that are receiving the curriculum? Are we reporting on the youth that are receiving the curriculum too?
Not necessarily. I would say yes and no, but I think what we're trying to capture is that evidence-based interventions are one way of serving young people, and offering them a different array of different opportunities allows young people to be whole, right? We're not talking about, for instance, you all at Girls Inc. do sexuality education program, but that's not the only thing you offer the girls that come through your program. So we really want to get an entire picture of every positive youth development aspects that you do offer your programs in addition to the evidence-based intervention, because we know that that's not the only thing that they need in order to be successful, to make the right decisions for themselves, in order to be who they want to be, right? So we want to be able to capture those different activities in order for us to tell the picture. As you know, these are non-sexual funds, and we want to be able to really capture and tell our federal partners that yes, we are doing evidence-based interventions, but that is not all that we do, right? And these are the other PYD activities that we take into consideration in order to offer a robust programming.
Okay, so for the informed and in charge that will be offering invoices, that'll be captured in the logs, not in the service delivery report.
Exactly.
Okay, thank you, Lisette. Thank you, Sin.
Of course. And Ashley, you have a question. Thank you, Sin.
Hi. Yeah, so I'm guessing Bridget probably already knows this. I'm from Girls Inc. of Lynn. Is it a separate SDR than the one we already do, or would it go on the same SDR?
So this is the same SDR. I'm assuming you're already fulfilling an SDR for ASC. So there may be some replicated numbers depending on the workshop, but ideally what you're doing is for Strive program activities, you are only capturing Strive program related activities. Does that sort of make sense?
Yes, thank you.
Awesome. Any other questions?
Sorry, I had a similar question to Ashley, just kind of clarifying youth not served by curriculum-based programming. So for our SDRs for ASC curriculum, we put like youth development and just like any youth programming we're doing outside of that. So if we're already putting that in our ASC SDR, can we leave that off of our Strive SDR, or do you want it reflected in both?
That's a great question. I would say just report it on one of them, um, just so that we don't duplicate numbers or activities and things to that nature. So if you're going to report it on the ASE, don't report it on the Strive so that we can kind of understand the picture.
Okay, thank you.
Yeah, of course. Any other questions? Great questions, everybody.
Thank you so much for your questions, everybody. So moving forward, so for monthly reminders, I will be sending an email every month, usually the first week of the month, to kind of give you a reminder of what's to come. So like every 15th, the EMIs are due. You have the SDRs that's also due on the 15th. And I will also send reminders for any program updates or any like technical assistance updates that come up as needed as well in this monthly reminder. And where in this reminder, you're gonna also have access to the links that you need and access to any emails, like if you need support, like for example the the OB, the EPI team, the DPH EPI team has their own very specific email as well. So I'll add that to the monthly reminders, so you can try if you need troubleshooting help, you'll also get that. So this is something you guys have already received like one monthly reminder from me for September to that's discussing early invoicing for staff timing that you've already had that you guys already have under your belt, and SDRs, since you guys are still wrapping up with your red cap accounts, you don't have to worry about that just yet. Just wait until we actually do the evaluation training and we go through the red cap. Then then you should feel free to start logging in your SDRs, just so everyone feels comfortable using the platform, because editing can be a little tricky on that. Awesome. So I'm gonna now we're gonna briefly talk about some upcoming plans for the office, and I'm gonna pass it off to Lizette.
Thank you, Tanisha. So we say congratulations, and we also say congratulations for everything else that we have to offer in our office. There are a lot of different things happening in the upcoming years. We are in the process of launching a division-wide youth advisory boards, and what that means is that what we hope to accomplish is that, you know, hopefully somewhat of a ladder. You all, depending on your program, you may offer a youth leadership opportunity. You may offer, summer internship opportunities for your young people. We would love to really think about what that looks like for them to then have an opportunity to apply for a youth advisory board on a state level. SIN will be leading that effort, and they will provide more information as the time comes. We literally are in the process of really looking at the vendors that we will be working with, and then more information will come from that. But that is definitely launching this fiscal year. The other piece is around launching the Youth for Youth initiatives mini grants. This is an opportunity for young people to really just kind of take charge for themselves and really think about activities that they would want to deliver within their programs. This is aside from our already existing funding, and also have youth-led initiatives or programming that supports their well-being or supports something that they want to accomplish within that year. And all of our Office of Sexual Health and Youth Development programs are able to apply for these mini grants, or young people are able to apply for this mini grants. The other piece is about launching funds to support activities that support programming to do any adaptations for youth with developmental disabilities. This is something that we have been talking for over 5 years in our office, and it's time for us to really put funding and supports to be able to either adapt the programming, to really look at curricula to be able to serve youth with IDD. We know that this is an increased population and also a priority population for our office. And we want to make sure that we provide opportunities for you all to be able to shift and really think about what does that look like for your agencies as well. So more information to come in the upcoming months around those funding opportunities. And the way that that will happen is that funding will be uploaded into your accounts, and it would be an amendment to your already existing accounts. The other piece, last but not least, we have been talking about this for about maybe 3 or 4 years, is the Voices revamp. We're actually in phase two of the revamp. We started revamping Voices. We understand that the Voices curricula was made for very, older youth, high school age youth, and youth that were going into post-secondary schools. And we understand and we have heard you all and all of the feedback that is needed in order to make sure that the curriculum is capable to address and also to address the need of a younger population and also the words and also to be able to reframe it in a way that it's able to that you're able to deliver to other populations. We're also really looking and working with other consultants to help us really adapt and really look at different curriculums to be able to support youth with IDD as well. So more to come on that. And then our office is also procuring in the next few years. I mean, we started last year with this particular procurement for the Strive program. In FY25, this fiscal year, we will be reprocuring the Pregnant and Parenting Teen Initiatives, which is our secondary prevention program for parents under 25. In FY26, we will be reprocuring the adolescent sexuality education programs and then also in FY27, FY28, we will be reprocuring the personal responsibility education. So it's important for you all to know that, again, our office is changing and our office is in the process of reprocuring. So if you are brand new to our office, these are other opportunities that you can partake in for funding or additional funding. And if you are already receiving maybe one or two of our funding streams, is an opportunity to receive additional funds as well. Next slide.
So to go over some upcoming events, today is the Strive program onboarding meeting, and tomorrow is going to be the Strive evaluation training meeting. So that, like, to reiterate, that is the red cap training and the data collection tools training. So that's going to specifically discuss that. So coming up in October, we do have the Project AIM training and the Real Essentials trainings. So look out from email. If you're doing those curricula, please look out from emails coming from me regarding logistics and planning and sending out the curriculum materials. So if you are taking any of these trainings, please look out and make sure that you have the address ready for the place to be. That would be the best location to send any materials if they need to be sent directly to your team. Additionally, we have a few voices training voices trainings coming up listed for November, and an Ocean Cafe also listed for December. So this is our current upcoming events, and as this event list grows, and we will be sending you monthly reminder. I will be sending you monthly reminders or any reminders, so you guys don't miss any opportunities that would work out really best for your team. So before we move forward, though, like, does anyone have any questions for us regarding any expectations, the data collection tools, or what's coming next?
Lena?
Thank you, Lisette. I had a question about the procurement for the Strive. Is this a 2-year grant or 1 year?
Yeah, no, this is a 5-year. So every 5 years we will reprocure. Mm-hmm.
All right, so this will be for 5 years. Okay.
Mm-hmm.
And then the other question I had was about the voices training. Are those individual trainings or all 3 dates for one training?
All 3 dates for the voices training.
So somebody would have to go to all 3 dates. Okay. All right. Thank you so much.
Whoever will be, that's a great question. Whoever is delivering the voices curriculum, which everybody is required, those are the 3 days for the voices training.
Okay. Thank you.
Yes. And just to reiterate that even if training or programming isn't happening, if you are spending staff time on Strive, please make sure to bill for it. And to circle back to the SDRs, I do want to mention some of the stuff written in the chat by Justine Egan and Brenna. So for Strive, you should select in the drop-down menu through the SDR section. So you should be able to get the Strive SDR separately. And you should be completing an SDR per program. So if you have Strive, Prep, and ASC, we do expect the SDR for Strive, Prep, and ASC. It's just when it comes to I think when it comes to the content of it all, just be careful about the duplications when it actually matters.
Awesome. Katie, I see your hand raised.
With regard to the voices training, we do have some staff who won't be available for 2 of those training days. How will that be handled?
They would have to wait till the next training.
Okay. And we don't know when that's scheduled yet.
Not yet.
Okay.
We are going to be working on a training calendar for our office, and we will share that hopefully before the end of October.
Great. Thank you.
You're welcome. Ms. Drayton?
Hi, yes. We have a new social worker, just started last Wednesday. Just want to know, how can I get her engaged with this? Because initially when we applied with our social worker as one of the staff members. And we now have a new person in that role.
Absolutely. I would say Tanisha would reach out and send her all of the, your staff information. If there's a new staff, you're more than welcome to send her that information so that she has all of the upcoming dates for training, especially for that.
Wonderful. Thank you.
I also want to mention that if this staff member will need a Red Cap account, just let me know. Well, sorry, I guess I could just ask now. Do you think they'll need a Red Cap account so we can set them up with that too?
Yes.
Okay, perfect. So yeah, just once I get the name and email, we'll be able to take care of all that on our side.
You'll get it before this meeting ends.
Sounds good.
Thank you, ladies.
Yeah, of course.
Of course.
Any other questions? Again, if anything comes up after this meeting that you might have forgot, just email Tanisha, myself, or anyone from the team. Next slide. Tanisha?
So this is our contact information. This team right here is myself and Ria. We're mostly going to be handling the Strive content. So Ria is our epidemiologist. So they'll be handling a lot of the data collection and can help you answer any Red Cap questions that you may need. If it's something that's just about troubleshooting, we do want you to reach out to the OSHA Epi team as well, and CC Ria to it so she can help with any urgent matters. But if it's something that can wait a little bit of time, or you need more direct, like step-by-step help, the OSHA Epi mass email is definitely a great resources to support you in that as well. And Lizette is also also supporting me as I'm getting acclimated. As you guys know, I am new to the team, and I'm really excited to start this project. But as such, there are a few random questions that I may not know the answer to, and Lizette's always a great person to CC in emails if you have any major questions that you need some support and answers about. Awesome. And of course, if you don't already follow us on any social media, you can follow the DPH accounts on Twitter, LinkedIn, and follow their blog as well. Just check out the DPH website on the Commonwealth. But just a quick moment, I am looking through some of you guys' sponsorships, and I see a lot of us think alike, a lot of Target, Starbucks, and like airlines. So I see we're a group that wants to travel and wants to live nicely. So that's very nice. But the Pizza Hut is awesome. I don't think they even have that many here. So like really great and unique sponsorship option there.
Awesome. Any additional questions? Tanisha, can we stop sharing so we can see folks as well?
I have a question.
Of course.
My question is with regard to the social media. What if any content from the clubs or the sites or the program are featured on there at any point in time?
We ask for folks to use consent forms or language for consent, and also any picture consent. We don't necessarily have a social media page for our office. We are working on that. We're literally just trying to figure out what the legality pieces of it through our department. The pages that Tanisha shared are DPH wide, so it doesn't necessarily cover all of our office individual stuff that we do have. We do have a page within our website that kind of highlights all of our programs and what we do. You are more than welcome to share, obviously with your own permissions of your organizations, to share any pictures of all of your participants. If you want to share it with us, we ask to make sure that your agency has a release form for pictures and things like that before sharing them with us. We do have a newsletter that we will be launching or relaunching again, and we like to highlight programs at that newsletter. And if there are any pictures that you would like to share, we just ask that we get permission first from the young people that will be, shared in those pictures. Great question. We're trying to catch up with the times. It's a journey for us. Great question. Anyone else?
Thank you.
Yeah, you're welcome.
I do have one question for everyone. So as part of the federal requirements for our site visit, we do have to double check and confirm that like the Strive sites do background checks on their staff. We think that you guys do, but I just wanted to confirm, like, thumbs up. Do you guys background check your employees as part of your process in hiring?
You went muted, Tanisha.
Awesome. Just wanted to see like a thumbs up either in the chat or in your window. Okay, awesome. I'm seeing the thumbs up. Thank you. We just needed to confirm just to make sure we have our documents right for our federal site visit coming up.
Yeah, that's a great great to bring up, Tanisha. We do have a federal site visit happening in the upcoming weeks, actually the second week of October. It is a new thing for us. The federal government hasn't done any site visits since previously to COVID, and also they've had, just like all of us, have had a lot of turnover in staff. We have not reached out to your program individually because obviously we are literally just onboarding you all. And it wouldn't be fair for us to be like, hey, join us for a site visit when we are literally just getting started. I have reached out to individual folks, either folks that have been previously funded that know the lay of the land as far as delivering Strive programming, to see if those folks are available. And also, given that our priority population is youth with developmental disabilities, the federal government is really looking at best practices so that they can start beginning to change their policies around how to support this particular population. So we will be providing them with an opportunity to ask questions to, the folks that have been doing this work for a long time and that are experts in this space. We will let you know about the outcome of the site visit. We will inform folks, but you don't need to worry. Not everybody will be, getting site visits from the federal government. I think it would just be one program, and then we will be kind of informing them about some of the initiatives and efforts that we are doing to be able to, meet the needs of the population, our priority population of youth with developmental disabilities. I did not get to meet all of you, so I know we have some time. So can we just do quick introductions, names, pronouns, and also your role within the program? If you don't mind, I'm gonna send it to you, Lena. If you can start us off and maybe start with your staff and then send it to somebody else.
Sure. It's very nice to see you, Lisette, and everyone on the team. So I'm Lena Crowley. I'm the director of the middle and high school programs here at Girls Inc. of Lynn. And on the call representing Girls Inc. of Lynn is Ashley Cinderella. She's with me. We're actually both filling in for, Ashley is part of the team. She's one of our health educators. And then Bridget Brewer is the supervisor of our teen pregnancy prevention programming, and she happens to be at a conference. So really excited about this opportunity to participate in Strive. So I guess, do you want me to popcorn it to someone else?
I'm happy to, actually. Okay. That's okay. Erin, would you mind introducing yourself and your team?
Sure. My name is Erin McSherry. I'm from the Edinburgh Center, and we have several programs, and the team that's going to kind of work on our Strive program is our children's mental health team that works with a bunch of different DMH contracts. We do have specialty with youth on the spectrum or with developmental disabilities. So that is what we are focusing on. And I have several team members on here. So we have Jess Losey, who is one of our clinical directors. We have Kate Russell, who is our senior director of children's mental health. We have Lauren, who is one of our program directors. We have Plum, who is one of our outreach clinicians. We have Addie, who is also one of our outreach clinicians. We have Scott, who is also one of our outreach clinicians, and we have Kristen Feeney, who is another one of our program directors.
Amazing. Welcome, welcome, welcome. I am going to pass it to Gabrielle.
Hi, everyone. My name is Gabrielle Witham. I'm Director of Healthy Lifestyles at Boys and Girls Clubs of Boston, and I'm serving kind of as the program manager for our Strive grant. We have with us today two clubs. So we have the Jordan Club, and Gina Centrella is there, the executive director. I think Lee, Jordan's social worker, is also on the call. I'm trying to see who else is here. I don't know if
David's
David
on.
or Anthony is here. And then we have the Yawkey Club. We have Elisa Drayton here, who's the executive director, in addition to Mercedes Thompson and Tate Ross, who will be the facilitators as well.
Awesome. Thank you so much. Ashley or Delisa, whichever one wants to start us off.
Hi, my name is Ashley. I work at Brockton Neighborhood Health Center. I'm the lead pediatric behavioral health integrated clinician. That's a mouthful of a title. Yeah, so we do strive and aim. Delisa has been doing it much longer than I have, but yeah, so we're just doing our thing.
Thanks, Ashley. My name is Delisa Vieira. I am the school-based services manager. I'm also the program coordinator slash Strive, AIM, and soon to be maybe another facilitator. So I do both roles. I fill in the gaps. And yeah, I've been doing this quite some time, so love it. Thank you.
Great. Thank you. Thank you both. So one really fun fact, Brockton Neighborhood Health Center and the Boys and Girls Club in Chelsea have previously been funded by the Strive program. And so they are pretty much experts. As you saw, they do deliver Project AIM and also voices for our younger population. So Delisa speaks like 4 languages, so she's been able to really look at, how to really support the population in Brockton and also the mental health background to really, as a social worker, has been able to really do some really cool things in the program. So not to put it out there, but these are really awesome resources. And I think Tanisha mentioned before that it is important for folks to collaborate as you begin to think about what delivery looks like for you. And if you start thinking about the population you are serving and providing, given that voices is, not necessarily made for a younger population, what adaptations have been made before, you're more than welcome to reach out as well. And I think we have Girls Inc. of the Valley. Do we have anyone here from Girls Inc. of the Valley?
Yes, hi. I'm Campbell. She, her pronouns. I'm the senior director of school year programs at Girls Inc. of the Valley. We're supposed to have 2 other folks on the call. Anna is our new assistant director of in-school programs. She's unfortunately sick today, but should be on tomorrow. So she'll be overseeing delivering programs for in-schools. And then we also have Peyton, who is on the call. Peyton's the assistant director for after-school programs, working with our teens. And she'll be running the Real Essentials curriculum with them in the spring. And that's our Strive team for this year.
That's awesome. Super exciting. Did I forget anybody? I hope I
Hi,
didn't.
Lisa. It's Monica. Can you hear me?
Yes, I can.
Hi. I'm currently in the car because right after this, I have to hop to another grant
No
meeting.
worries.
But I'm from Low Community Health Center Team Block. And our health educators, there are 3 of them, but they're currently in school right now. I'm doing MPC. But the coordinator is Triana Wilson, who actually will be, her last day is actually this Thursday. So there will be some staff changes and rehiring happening at Team Block. And then the other 2 health educators are Jen and Mercy.
Amazing. Thank you so much. So nice to see you, Monica.
Good to see you too.
Also, another fun fact, Lowell Community Health Center, Girls Inc. of the Valley, Girls Inc. of Lynn are also duly funded. They receive Strive programming and they also receive adolescent sexuality education programming. So if you're thinking about anything else that you would want to do, given that our office is reprocuring in the next 3+ years, these are the folks to really think about and talk to about any other additional opportunities that we have to offer. Or even if you are thinking about applying for the mini grants or any other one of our offices additional funding to really be able to support our values, these are the folks that have done it for a really long time and they have been able to accomplish really phenomenal things with young people within their programs with the Youth for Youth mini grants and also any youth leadership opportunities that we do offer across the state.
I do want to briefly mention that, like, if you are interested in like talking to any other organization and just picking their team's brain about like any strategies and processes, please just let me know, and I'll be happy to make the warm handoff between your team and a different one, just so you guys are able to connect and collaborate. Yeah, no, you guys each all bring something a little different, and whether it comes from expertise, experience, or just with the community you plan to serve. So I do think like all together we can really like fill in the gaps for each other and just like make this a really great and successful year.
And one thing, and last but not least, I think one thing that I mentioned to some folks is that, you know, we do have obviously requirements of our grant, requirements of the funding. This is also a collaboration. We're also learning as we go. And we know that, you know, working with youth with developmental disabilities, it's something that our office has been talking about and has been, you know, gearing towards where we are currently in offering funding opportunities and other opportunities to be able to shift and change the way you do programming for this particular population. We are also learning as we go. So we welcome any, you know, best practices and also to really collaborate with all of you to make this the best program for young people, for the young people you serve. So we welcome any feedback. We welcome any ways of really being able to support the population, and we want to do that in collaboration with all of you. So thank you all for everything that you do on a day-to-day basis. We are super excited to have you all in our office. The fun will come sooner rather than later. I know that we're literally just getting started, but looking forward to working with all of you. Thank you so much, and see you all tomorrow for the evaluation training.
Thank you.
Thank
Take
you.
care.
Bye, everybody.
Thank you.
Have a great day, everybody.
OSHA staff, can you stay just for a few seconds?
You want me to stop recording? Use it?
Yes, please.